Welcome to the Learning module for entering coordination of benefits with third-party liability into a claim. This video does not cover the full claim submission process. If you have not submitted a DDE claim before, please refer to the Minutes User Manual and select the appropriate claim for your service. Use the basic instruction guide if the individual service is not listed. In this video, you will watch as we add coordination of benefits information in a Minutes direct data entry claim. This module does not cover how to enter Medicare or Medicare Advantage Plans. What is third-party liability, or TPL? TPL refers to health, long-term care, or dental insurance coverage an MHCP member may have through private or public funds. What is coordination of benefits, or COB? COB is a process to determine who pays first when two or more insurance plans are responsible for paying the same claim. If an MHCP member receiving services is covered by a TPL insurance, you must first bill that TPL before billing Medicaid. There are two ways to enter coordination of benefits in a claim: claim level and line level. The method for entering COB is based on the claim type and provider type. In our first example, we will demonstrate how to enter COB in a claim level. After we log into our Minutes account, we click on Submit DDE Claims on our left navigation and select the Professional 837P claim form. This will take us directly to the Professional Claim screen. We assume that you know how to complete the initial screens when submitting a claim, so we will navigate directly to the COB screen. When we enter COB, we use information from an Explanation of Benefits, or EOB. An EOB is a statement from the TPL that shows the details of a submitted claim. Let us review a sample. EOBs look different based on the issuing health plans, so what you receive may look different than our example. Using our EOB, we locate the other payer name and their other payer primary ID. In our example, the other payer is Medica, and the other payer primary ID is listed on our EOB. We enter this information on the COB screen in Minutes. Next, we enter the Claim Filing Indicator by selecting the most appropriate one from the drop-down menu. We will select CI, Commercial Insurance Company. After we complete this section, the system will automatically open the Other Payer Subscriber section. The Other Payer Subscriber section identifies the insurance carrier's level of responsibility for payment of the claim. In this section, we enter the payer responsibility, the insured ID, and relationship code. Medica is the primary payer, so we select P, Primary, from the drop-down. We enter Medica's group ID from the EOB. We select 18, Self, for the relationship code, because John Doe is the policyholder. The next section is the Claim Level Adjustments section. On our example, we have two adjustments, and we will enter them one at a time. For the first adjustment, our group code is PR. The adjustment reason code is 1, and the adjustment amount is $81.54. The adjustment quantity is an optional field, so we will leave it blank. After we enter this information on the Minutes screen, we click the Add button in this section. Note, the information will not be recorded in the claim if we miss this step. Our claim has another adjustment, so we repeat this step to add it to the claim. Next is the Other Payer Amounts section, where we enter the payer paid amount and the non-covered charge amount. On our EOB, Medica is the payer, and they have not paid anything, so the non-covered charge is $211. The last step is the Other Insurance Information section. Both the benefits assignment and release of information are defaulted to yes. This is correct for our claim, but you should review this section when submitting your EOB. We click the Save button to save the TPL information entered. If everything that is required has been entered, a message will display at the top of the screen that says, Claim Level COB has been saved. If our member had additional insurance, we select the Add button at the bottom of the page to repeat this entire process. Once all COB information is added, we click Continue at the bottom of the screen to complete the claim as normal. If you cannot find the information on your EOB to complete your claim, refer to the X12 External Codes list or select the Help link at the top of the page. In our next example, we will demonstrate the process of entering a claim with line level adjustments. For a line level claim, each individual line will have its own adjustment, so the information on the EOB is entered in a different way than our first example. Like our first example, we will enter the information on the COB screen, but only for the other payer and other payer subscriber. We click the Save button to save our entered TPL information, then click Continue to go to the Claim Services page. The Claim Services page is where we enter line level COB. Our sample EOB has 2 lines, and we enter the adjustments for each line separately. We enter the Claim Services information for the first line and select Other Payer in the accordion list and enter the requested information from the EOB. We select the Other Payer identifier from the drop-down menu. If there are no options in this field, we would return to the COB screen and enter the TPL insurance information in the previous step. Our drop-down selection has Medica's information. We enter the service line paid amount, adjudication payment date, and the paid unit count. We enter $211, June 5th, 2020, and 1 for the paid unit count. Next, we go to the COB Line Adjustments Entry section to enter the Claim Adjustment Group Code, Adjustment Reason Code, Adjustment Amount, and the Adjustment Quantity. The Claim Adjustment Group Code is PR. The Adjustment Reason Code is 1. The Adjustment Amount is $81.54. The Adjustment Quantity is optional, so we will leave it blank. Like our previous example, we must select the Add button to the right of the cell to enter the information in the claim. We have an additional adjustment on the first line, so we repeat the process. Once all the information from the first line on the EOB is entered, we click Save and complete the additional screens on this page for the service. To add the second line of service from our EOB, we click on the Add button at the bottom of the screen. We repeat the same process for the second line of service on the EOB, and then we complete the claim as normal. In this video, you have learned how to enter coordination of benefits in a direct data claim, step-by-step instructions on how to submit a claim level and line level COB is located in the Minutes User Manual. If you have questions about submitting a claim, contact the Provider Call Center at 651-431-2700 or 800-366-5411. The Department of Human Services offers various training opportunities, including other on-demand videos and online sessions. You can register for online sessions by visiting the MHCP Enrolled Provider Training page on the DHS Provider website. Check the MHCP Provider News and Updates for announcements on changes to programs and information about new learning tutorials when they become available. Thank you.